Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. And coming to the etiology, what is the reason for ADHD? The first one is it has strong genetic component. It means if any one of your relatives, blood relatives has ADHD, you are at high risk of getting ADHD. And one more thing is recent which we are observing multitask, especially with the electronic gadgets. So you are working on the computer simultaneously, you are watching something in the TV, you are watching something in the mobile phone, and you are doing your work. So if you multitask, this is one of the major risk factor, especially in adults for ADHD. And coming to the pathology, what happens in your brain when you have ADHD? So the first thing that is going to happen in these guys is they have low levels of dopamine. Dopamine is the important neurotransmitter in your brain. The children with ADHD will have low dopamine levels. This causes asynchronized firing of the neurons. Basically, when the default mode networks are excited, task mode network should be inhibited. When task mode networks are excited, default mode network should be inhibited. There should be a seesaw action between these two. When there is low dopamine in the system, synchrony is lost. Both are excited at once or both are inhibited at once. And also, as we said, the three physical areas in the default mode networks should be excited at once. Here, what happens due to low dopamine is these three areas are not excited at once. One area is excited, other two areas are depressed. In the same way, in task mode network, there are two physical areas in the brain. These also to be excited at once. In case of low dopamine, even there is asynchrony between task mode networks. Instead of exciting at once, these task mode networks, one is excited, one is depressed. So this causes totally asynchrony in seesaw movement, where the neurons has to be excited at once. It will not happen due to low dopamine. This causes the agitation in the brain of a ADHD child.